Great. Welcome, everybody, to Navigating Optum Supervisory Protocol with Thrive Services. My name is Ashlee Secord. I'm here with Molly Gregg. Molly, would you mind introducing yourself?
Absolutely. I am Molly. I am the project manager, and I also do some billing work with Ashlee at Thrive. I've been with the company for going on 4 and some change years now. And so I'm excited to step into the project management role a little bit more, and kind of be the point of contact for everybody on the call as needed.
Awesome. Thank you. My name is Ashlee. I started Thrive Services just over 5 years ago. I saw a little bit of a gap in the community for mental health professionals with billing and credentialing services. And it was something that I had been thinking about probably for 3 years leading up to that point. In addition to owning this company, I also have a private practice in the state of Minnesota and in the state of South Carolina. So I would say that I have a lot of experience and have learned a lot of things along the way. The supervisory protocol with Optum is one of those things that I have gone through and feel like having a workshop and resources available to providers would be really beneficial outside of the information that Optum also provides. So that was sort of the brainchild for this event. Going into this, I give you a little overview. We will be looking at the supervisory protocol audit. I will share screens of the actual audit tools that they provide you. We'll review steps to prepare your private practice with the required documents. We'll also address the emotional side and talk about ways to reduce anxiety leading up to the site visit, as well as resources for making your audit go smoothly. Before we do that, I just want to get a little bit of information from you guys, if you don't mind sharing. Share as much or as little information as you would like. Where is everybody from? Where is everybody calling in from? Minneapolis, great. Awesome. Lots of Minnesota people. I feel like I typically connect with a lot of people in that area. Maryland, that's great. Awesome. Lots of Minneapolis. I love it. Excellent. Thanks for being here. Ooh. Excellent. How many contractors or employees does your practice have? Great. Excellent. You guys are all, wow, amazing. Excellent. Great. And then how many of those contractors, if they are contractors, are pre-licensed staff? Or maybe you don't have pre-licensed staff. Okay. Great. Awesome. We got the full spectrum. Excellent. How many of you are familiar with the Optum's supervisory protocol or know somebody who's gone through it? And if you don't, that's fine. I know some people have connected with other therapists who have gone through it or heard through it through their insurance company. Okay. Oh, amazing. Somebody's going through it.
Currently.
Yeah. Excellent. Okay, cool. So some of this information might be new. Some of this information might be repetitive. I want to give like a full picture of what the supervisory protocol is. And if you have any questions along the way, please use the chat box to ask for clarification. If I don't see your question, Molly will definitely tap me on the shoulder to make sure that I answer it. Great. So the supervisory contract is, here's the definition. It was actually a manual. I saw somebody here from Maryland. Maryland actually has a really great, like, I think, what is it? Just a document that goes over the supervisory contract very well. And I pulled this from their manual. It's a group contract that allows non-credentialed clinicians to render services while under the supervision of an independently licensed clinician. And they use the word non-credentialed here. I would use the word pre-licensed. I don't think anyone is using this contract to bill for other fully licensed providers. I would say that this is typically for billing for those in the graduate level pre-licensed providers. The terms of this contract are that clinicians are rendering psychotherapy services and they have at least a master's degree. The services that are rendered are within the scope of the clinician's training. Supervision must occur regularly on a one-on-one basis and be documented. And that Optum may periodically conduct a chart audit to ensure the compliance with their policies and procedures. This is what the timeline looks like in order to start the process for obtaining your contract. So the first step is you'll request a supervisory protocol contract. I'm going to show you the resource and actually provide you the link in just a second. So you'll go to theproviderexpress.com to find your provider relations advocate to formally request this addendum once you have 5 fully licensed providers on staff. So I will show you, I have this here. So I'm going to send you this link first. And that will bring you to the states. And then I have the Minnesota one pulled up specifically. That will show you, once you click on it, it'll show you your provider. So let's say for Minnesota, it'll show you all of the counties that your provider is, which representative is your provider for your county. So that's the person that you would reach out to for your addendum. That is there. So for the Minnesota folks, I will send this one. Excellent. 2 master's level clinicians. Excellent. Great. So from there, once you send the request, you will then be responded to from an Optum clinical quality analyst. And they'll reach out to you via email and phone to review the information with you once your request has been accepted. And then you'll start to get all of the information all at once, and then they'll set up a phone call to meet with you to go over all of the information. And this quality analyst is, we'll kind of step into that next. That quality analyst is a mental health professional as well. So in the state of Minnesota, you might have an LPCC or an LMFT who's going to be reviewing your documents. That'll be your auditor, will be a peer essentially, which I think is just kind of nice to know. The next part of the timeline is I would recommend reviewing the audit tools. I probably read through the audit tools, like no joke, probably 20 times in the process of like reading through, okay, what do I need? Reading through and figuring out which information I had and didn't have, reading through, make sure I had what I said I had. Like it was just this sort of repetitive thing to make sure that all of my ducks were in a row and all of the items on the list were in the documents that I had listed. Preparing for the site audit, they have a secure portal that allows you to upload documents once you have completed them. I highly recommend utilizing this. They won't provide you access unless you request it. They let you know at the phone call, at your initial phone call, that you are that you can have access to this. cannot recommend it enough. Ultimately, it just lets you like upload. And the more information you upload for them to review before your audit, the less time they're going to spend at your site audit visit. So that 4-hour visit can, my visit ended up only being an hour because I uploaded every single document I possibly could beforehand. So it ended up being more of a conversation by the time the site audit arose. That site audit is a conversational review of your documents, processes, and site with your clinical quality analyst. It was very casual, very relaxed. They have recommendations if something was missing from some of your documents, but it's certainly not a like this hypercritical, judgmental experience of your site or your documents. It's more like, we didn't notice this, we recommend using this language, that type of thing. Any questions so far? All right. Looks like, oh, 2 questions. What I will do is I'm going to send this video to all of you after the presentation. If you are telehealth, that's a good question that I would maybe ask your advocate, because I did have a site, but I do think that like the site audit visit, I'm wondering if it would be an obstacle because a lot of the tool is about your physical location, and they might have questions about supervision for pre-licensed providers, like how are you overseeing their, I know it's not that different, but it might be a good question to ask like your advocate. And does an LMSW count as licensing reference 5 license to initiate the agreement? Is the LMSW the licensed mental health social worker? Is it a, okay. And is that in your state, is that considered, okay. In your state, is that considered fully licensed? No, then probably not. I would guess not. I would say if I'm not familiar. I think you said you were from Maryland. I'm not familiar with the credentials, but I know in Minnesota we have 3 or 4 master level, and then we have like the LPs and like the sort of doctorate level, and those were the ones that were considered the fully licensed clinicians, and everything else was considered like a pre-licensed. But again, a super great question to ask your advocate, but I'm going to surmise that it's probably not included. Any other questions? Yeah, you're welcome. Just to reiterate, I think I mentioned already, contact the provider relations advocate for your area, varies by state, varies by county, and I already gave you the links. Same thing, Optum clinical quality analyst. They will reach out to you. It's a mental health professional, and they will be your point of contact leading up to the audit, and will be the person that you meet with for your audit. Something I didn't mention is typically when you request the audit, they try to schedule the site visit within a month. It's a pretty small, at least in my experience, it's a smaller window. So it's just something good to keep in mind if you're starting to prepare or get some things in order. If you're only 1 clinician away from like having 5 fully licensed staff, this might be a good time to sort of put some of these pieces in place so that when you do apply for the audit, you're sort of like, okay, I'm completely ready to take this on, or I only have a few things to put in order, that sort of thing. Somebody asked, does everyone have to have an audit? I just got credentialed to have the supervisory protocol added to my contract. That's excellent. ours included a site audit, and you're in Minnesota too, Sue Ellen, did you say? Which state are you in? Oh, she's in Rhode Island. That's right.
Yeah.
Okay. I'm under the impression that the audit is a part of the process. If Rhode Island doesn't include that, I will say in the state of Minnesota, we have a site audit. But I do like if you just got credentialed with it, that's awesome. And is it already like uploaded and going? Oh, okay. You're in the process. Sounds good. Yeah, so the audit, I think using that word, they're all audit tools, so that you'll see in a second once we review that. The audit tools will, like, you'll see all of these sort of line items that they go through to make sure, like, ultimately this quality assurance is they're wanting to ensure that your pre-licensed providers are providing the same level of care and have a high level of supervision from fully licensed providers to their members. So if they're going to be compensating us for these pre-licensed providers, they want to ensure that you have policies and procedures in place that they are providing as high of a level of care and are being overseen at that high level as well. Okay. So these are the 3 audit tools that we're going to go through. One is the agency site tool, which is the environment of care, your policies and procedures, and human resources. The treatment record tool is their review of 3 case files. 2 will be inactive and 1 will be active. And these can be non-Optum clients, but I chose Optum clients to send over just because that's just one less layer of like HIPAA affiliation on my end. Clients have already signed off on providing access to their records to their insurance company. So I recommend using Optum clients if you have at least 3. And then the supervisory protocol tool. This is the shortest, briefest of the audit tools. Proof of supervision by a credentialed supervisor, and then they want the supervision policies and procedures that you have in place as well. Starting with the agency site tool, these are the 9 areas that they cover in that site tool. The environment of care, rights and responsibilities, safety and security, addressing infectious diseases, treatment records, how complaints are managed, how treatment access from clients, patient safety, and service delivery. And this, I will show you an example of the tool. So this is a snapshot of the actual tool. This is the very first page, environment of care. Facility location is easily identifiable from the street. Furnishings and decor are appropriately professional. Waiting room and patient care areas are adequate size and reasonably comfortable. No culturally offensive materials. Fire safety plan. Exits are well marked, free of obstruction. Pretty straightforward. It's very yes or no on those first items. And then you start to get to like, you're like, okay, yeah, like I don't have any offensive materials posted. And then it starts asking about a safety plan. It starts asking about fire extinguishers or a fire suppression system. So some of those things, if you don't already have them in place or don't have an actual facility, those are good things to follow up with your advocate to see if there's, maybe there's a telehealth version of the audit. And just so you know, you'll receive a copy of this when you hear from your analyst. Like they will provide you all 3 tools for you to review. Here's another page. Policies addressing safety and security, policies and procedures for dealing with life-threatening emergencies, Policies addressing control of hazardous materials, cleaning supplies, and wastes. Policy addressing management of any spills of bodily fluids. That was a very new one for me. I was like, I don't think I've ever really considered a policy for that. And they mention a little note here. They say at your level of care, aka if somebody vomits or cuts themselves. That I was like, okay, I guess that could happen in a therapy office. One more page here. The policy or written criteria for assessment procedures includes evaluation of learning needs and barriers to learning. So this would be like in their treatment plan or evaluation. Assessment procedures includes mental status exam. Assessment procedures includes risk assessments. And criteria for assessment procedures includes identification of community resources used by patients. I mentioned that one because that was something that they had brought up in my audit. They had for some of the like termination notes, they had recommended including language for like resources that would be available to the client as a recommendation. So I like to point out that one, their emphasis on community resources. And then criteria for assessment procedures includes identification and prominent listing of relevant medical conditions, lots and lots of policies and procedures. I will show you, we're going to show you a resource at the end, but we have a policy and procedure manual that includes all of those requests for that treatment tool, including the other ones, just so you can see it here. We'll review this in more detail as we get closer to the end of it. But I just want you to know, like, when I first read through the audit tool, I don't know if I had a panic attack, but I certainly had some anxiety rising where I was like, what? This event as well, because I was like, I do have some of these policies and procedures written, but I don't have a lot of the ones that they're asking for. So sort of getting the word out is, I think, helpful for providers who might be looking to start this process before they apply, because having that small time, that time crunch window almost made it a little bit more elevated. Second, the treatment record tool. Like I mentioned before, it's a review of 3 treatment records, 2 active, 1 inactive, and that there are 7 sections in this audit tool: general documentation standards, initial assessment, treatment planning, progress notes. They have a medication management section. If you do not have that in your, if you don't utilize that in your clinic, it's not applicable. I caps locked coordination of care. They expressed that this is a very important area. So we'll spend some time looking just at that particular slide, and then as well as discharge and transfer. So I will show you those slides. This is the first page of the treatment record audit tool. Again, they start off pretty cut and dry. Each client has a separate record. If you are using an EHR, this is an automatic yes. Each record includes the client's address, employer, or school. All entries of the record include responsible service provider's name, professional degree, and relevant identification number. So this would be your signature at the end. If you're using an EHR where you use a digital signature or checkbox that signs off, this would, again, check that box. The record is clearly legible and someone other than the writer. Evidence of a consent of treatment or informed consent on record that is signed by the client or legal guardian. If your EHR has your client sign these documents in the EHR, that's sufficient. Documentation that the service provider provides education to client and family about service planning, discharge planning, supportive community services, behavioral health problems, and care options. Documentation that the risk of non-compliance with treatment recommendations are discussed with the client and/or family legal guardian. So think of this as like your notes are all representing this. This isn't policies and procedures. This is they're essentially looking at a full case file for 3 clients, 2 of which have are no longer working with you and have like your termination note, recommendations, all of that. That's all they're pulling this data from. Pull the next page. Oops, skipped one. Some more examples. You can kind of see like the numbers on the left here. This is, you know, probably 4 pages in. Screening indicates an active alcohol or substance use problem. The substance identified as being misused was alcohol. Some of these are non-scored items. The treatment planning side, there's documentation or a signed form and a progress note that the client or legal guardian has agreed to the treatment plan. The treatment plan is consistent with the diagnosis. The treatment plan has objective and measurable short and long-term goals and includes estimated timeframes for the goal attainment. And that's I feel like that's built into a lot of our treatment plan EHR templates. The treatment record includes a safety plan when active risks or issues are identified. And then the last one is the coordination of care one. It's its own page all by itself. It's highlighted in pink and I think emphasizes their level of their emphasis on the importance of coordination of care. So they're going to be looking for if the patient has a medical physician, if we requested that information, and if we requested coordinating with that physician. And it can even be that we asked and they said no, and that was that was it. It can be yes, and we reached out and they never responded. That sort of demonstration of having reached out is sufficient. And then if you reach out and they respond and you have you had a conversation, that you're showing that documentation of that contact with that PCP. And that's all here, the documentation, or refuse consent. If the patient is being seen by another behavioral health clinician, record documents that the patient was asked whether or not they are being seen by another behavioral clinician, documentation. I think we're all very familiar with coordination of care. They're looking for that specific documentation of all of that. Any questions so far about those 2 tools? I see Starlane. Since we have 9 total clinicians in the practice, 3 owners, 6 employees, any guidance which providers clients to pick from for the treatment record audit? Or would it make most sense to use clients of the provider who is actually providing the supervision? That's a really great question. So I will tell you what I would recommend is going through the treatment record tool to see like what boxes needed to be checked. And I would go look for the clients that sort of have the fullest record that check all of those boxes. So it doesn't, the clinician really isn't, I'm going to use the word important. It can be a pre-licensed provider. It can be a supervisor, it can be just a fully licensed provider. So if you have a lot of clients to draw from, then I would just pick the ones that like sort of fit the criteria, that like best fit the criteria for that. Another thing too, like going into the audit, if you get a new Optum client, knowing you have all of these boxes that they're wanting to check, you're sort of going into that new client and you're making sure that like you're like there's a fine-tooth comb, like that you're making sure those boxes are checked going into the new client as well. But for those but I guess for the inactive ones, yeah, I would make sure I would just look for the ones that, you know, have that coordination of care box checked, that have a really thorough DA and are like very detailed. Like I would look for the clinicians who are the most detailed. That would be my recommendation. I ended up using, Yeah, you're welcome. I ended up using mine because it was just easier to know like which clients of mine I had that type of information. I even had one for like to be able to demonstrate the risk assessment, that sort of thing. But that's also like if you don't have a client with that, that's also fine. Yeah. Any other questions? Great. We will move on to the supervisory protocol tool. This is just a 2-page tool. It's a supervisor review, supervisee review, supervision policies and procedures, documentation of recurring supervision, and informed consent. So I will just show you the tool first. The clinical supervisors are Optum UBH credentialed clinician. There's a written policy addressing the supervisory protocol utilized at the clinic. The patient's diagnostic assessment, treatment plan, and changes in diagnosis are reviewed and signed by the clinical supervisor. So if your EHR is set up to have the supervisor sign your pre-licensed staff notes, then that sort of meets that criteria already. Clinical supervisor reviews and signs the patient record at least every 30 days. So that one would be like that at least every 30 days. Think of that more as a policy and procedure and less like how do I show that my supervisor is signing those every 30 days. That's more policy driven than I would say like here's when they signed it, here's when they signed it, right? Like that might be a little bit harder to demonstrate or just more paperwork. Verification of the supervisees training and education is documented and available for review. So think of that as a resume or a validation of their transcript, something along those lines. Documentation that the supervisor and supervisee meet regularly on a one-on-one basis for supervision. This can be like a screenshot from the EHR, like however you have your supervisors document their meetings. We have our supervisors document it in the actual EHR system, like the practices EHR system, so that it's just very visible and very obvious when they're meeting and when they're not meeting, if a meeting is canceled, that sort of thing. If it's it can be documented. That's just how we document it. You can document it in a shared file. You can document it in any way that you want to. Just has to be visible. Supervisor's education level meets the state clinical supervisory requirements, and or the supervisor's education level is consistent with the supervisees. In my world in Minnesota, this isn't necessary, but having an LMFT supervisor for our LAMFT clinicians is how our supervision is set up and how we have them like have their notes signed. I also think it's important that they can sign off on their hours for licensure. So our LGSWs are lined up with our supervisor LCSWs, LICSWs, and so we have those sort of like matched up. So that sort of policy meets that requirement in my mind. That translates very easily. A lot of states, like insurance companies, don't necessarily require that tier. Like they just want a licensed supervisor overseeing the pre-licensed supervisor. And some insurance companies don't even have that clinical supervision requirement, oddly enough. However, I do think it's sort of like best practice to have some level of or some training in that clinical supervision like system. So I'm guessing that a lot of you probably already have that set up as well. So just having that documented and in place is just like it'll be an easy checkbox. Great. Any other questions? We're going to switch to preparing. I kind of showed you examples of all the tools. I will tell you, if I went through every single page on the tool, this would be a much longer meeting. It is very extensive. There are a lot of bullet points. Some of them are very easy, like, do you have any offensive material in your waiting room? No. And then there's other ones like, tell us your Sentinel events policy and procedure. And I was like, I don't know what a Sentinel event is. I need to figure that out. So it's very thorough, but I want to make sure that we sort of, if there's any questions sort of about that part, we answer those first before we go into preparing. Okay, I think we're okay. Great. So this is, again, just a suggestion. If you already are a very organized person and are like, feel very apt to taking it on, by all means. But this was just how it made sense in my world for organizing the information and getting prepared for sending the information over. So have a plan of attack for assembling the documents and files that you have, as well as the documents you need. So as we mentioned before, review the audit tools and review them again and review them again. I downloaded mine onto my iPad and highlighted the things that I needed, and then used a different color to highlight the items that I already had. Start collecting documents, and we'll go, the next slide will show you which documents that you might already have to be able to draw from. Selecting client records or starting to review client records, and then sort of focusing on what's missing. So we'll go through those. We're going to start with collecting documents. So if you are in a clinic, you have staff, you have employees, I'm going to guess that you have some type of manuals or have started policies and procedures, or you have people doing processes out of order. So then you're like, we have to update that and make sure everybody's doing something the same. So any sort of collective document that you have, where you have staff, even contractors reviewing, that's going to be important information to read through and see if it matches up with some of the requirements in the audit tool. So this would look like a policy and procedure manual, if you have any employee manuals, if you have a supervision manual. And it can just, it might not be a manual, it might just be a policy that you emailed out to everybody. Like reviewing those emails would be really smart. And your informed consent is going to have a lot of that first, not the treatment tool, but from that first audit tool, you're going to have like that, your informed consent is going to have a lot of those policies and procedures that you're relaying to clients. You'll be able to pull some of that for your audit, and you don't have to separate those things out. This is probably helpful information. You don't have to divvy all that information out and highlight it for them and be like, this is number 3. You can just know that number 3 is in, and like let number 3, number 8, number 12 are all in your informed consent, and you can upload that document and they'll check it off. Like you don't have to clean anything up for them. You can just say, yep, I have that. It's in this document. They'll review it. They'll check it off. Like it's really like helpful. Your contracts with staff, supervisors, and employees, that information, there might be information about your supervisory policies and procedures in there, like verification and requirements for hiring staff and supervisors. All that information, again, you can just upload your contracts and be like, yep, that checks off these, and these. In your mind, you don't have to tell them which boxes it checks. Personnel files and client records. I will tell you the personnel files, something that like I hit the easy button on was if you have access to any of your clinicians, like credentialing portals, like if you provided credentialing and they authorized you to do credentialing for them, I took screenshots of their like clinical history, their license, like that credentialing portal has a lot of the documentation requested in the tools. And I just took screenshots and sent that in instead of recreating a document that had all of that information, uploaded that, and it checked all those boxes. So that was like a little like easy button, like we have all of that. Every clinician has most likely has a CAQH if they're accepting insurance. And all of that, those are personnel files for all, as far as I'm concerned, and has all of the information that we need for our clinicians. And then finally, client records. That one I think you guys already knew. Just by a show of hands, and there's no shame in this at all, does your practice have like some of the policies that we have discussed drafted, or emails or communications? Are your wheels starting to spin about like, okay, like I might have some of this stuff already? Great. Awesome. Perfect. Going into more detail about selecting the client records, you asked, like, we had a question earlier about which records to select. Thorough data collection at the onset of therapy, a really detailed intake summary, the coordination of care, finding that clinician that, or the client where that coordination of care is documented, is going to be really important to this specific audit and efforts to reach that client's PCP. And then termination outcome, that you're putting that outcome, recommendation, and referral listed in that termination. And then this one is like ultimately where you'll be spending the majority of your time outside of uploading documents, is what's missing. What items on the tools remain after reviewing your documents and policies, and then just start that list of items that need generating or editing or creating. And then organize a list based on the manual and document they belong in, just so you can cross-reference when you check it off. You're like, you know which one you're going to, because again, those audit tools are like outside of the supervisory protocol one. They're just really long. they're a lot to pull from. So knowing which documents are needed for which one is sort of helpful. And if you are missing or don't have policies, you can start to like create those as you go. Are there any policies and procedures that you heard about that you're like, yep, I definitely need those? And if nothing comes to mind, that's okay too. Yeah. Bodily fluids, LOL. Yeah, that was a weird one. I was like kind of cracking up. Yeah, there's a whole like infectious disease one that I was like, okay, all right, I need to like put something together for this. Awesome. Great. So here's a little audit strategy that is a brainchild out of the high amount of anxiety that I experienced going through my audit. Don't try to do it all at once. I would certainly try, if you are an eat the frog type of person where you want to do the hardest parts first, start there. If you're like, I need to just get done what I can get done so I can focus on the harder ones, go upload all of those documents that you know you do have, start tracking that stuff down, start rereading them to know. So like just getting familiar with what you have and what you need, like that takes a little bit of time. So just rereading some of that. Blocking off time each day or week to commit to it and like really focus on it can be very helpful. Using the audit tools as your actual checklist. Like I said, put it on my iPad if you print them out. Just sort of utilizing that tool instead of recreating it, I think is really helpful, because that's exactly what they're using to go through your materials. And then I just listed, it's no time to be a perfectionist. They, like I mentioned, they will accept so much information. They'll accept screenshots. They'll accept like your informed consent policy and all of the documents that are, all of the policies that you have listed there, your contracts. They'll accept all of these sort of documents that you have already as they're checking off all those boxes. So you don't need to have it necessarily like all in this sort of clean little, bundle. I like to ask this question because I know what my reaction was when I got the audit tools. What is your reaction as a result of seeing like pieces of the audit tool and like hearing about it, I guess? Any initial reactions or responses? And it might just be like, yeah, no big deal. I already have all that stuff. I'm just going to send it in. Or it might be like, what am I getting myself into?
This is my third or fourth time hearing all this information, and every single time I still go, wow, there's a lot.
Sure. Yeah. Ani said this is like she expected this. That's great. Feeling word, oddly calm and excited. That's amazing. That is awesome. I'm happy to hear that. And you are welcome. Great. Okay, so none of you felt anxious. So those of you who might be feeling anxious and didn't mention it, or I'll just remind myself, the audit is a conversation between colleagues about the documents you provided. You're literally talking with a peer. They are very kind, and this is not their first audit. And I'm like, yeah, it's certainly not this like, what are you doing wrong? Let me find what you are doing wrong. It's certainly like they want you to pass. They want like if they notice something, they're like, yeah, let's fix it. Optum wants you to be successful and ensure you're providing the appropriate amount of support and oversight to supervisees. And there are no consequences to not passing. They're not going to remove what access you have to your current Optum contracts. And then lastly, you're probably going to pass. Like I don't think I've heard of anyone not passing. If you complete the majority of this information and submit it, yeah, I've not heard of anyone getting less than like a 90% on there. And there is a percentage because they have all of these like calculations or whatever. Yeah, I think like just kind of keeping that in mind during the process. But you're all really calm and collected, so I don't know. Don't even worry about it. Just so you all know, as a part of processing my anxiety from my own experience, we have a policy and procedure template that I showed you. I did show you the table of contents. It's 25 thorough policies required for the supervisory protocol audit. Each policy can be customized to your practice. It includes policies and procedures for the treatment record, supervision and supervisee, clinic site, and human resources. I'll show you the table of contents again, just so you can see, like we have the infection control, the incident report, or the sentinel events policy. We even have the spills and bodily fluids policy in there. We have supervisors and pre-licensed staff. We have the whole supervision, supervisory policies and procedures in place. And then I'm just going to show you a few examples of what those look like so you get an idea of that. It is a very editable document. So it's very thorough in the policy, and then it gives you a place to add your private practice information. And I also pulled up, I'll show you a few examples, and then I'll show you which, there's a few policies that are not included because they're not really necessarily like, one's like a pet policy. And if you needed one, I think you could probably find one. Grievance policy, that's built in. This is just like partial page. Like a lot of these policies and procedures are about 1.5 to 2 pages. Depending on the policy itself. The complaint one is a little bit longer. Here's the infection control policy. Again, you can see like which ones have it. I will say if you're in the state of Minnesota, this is very state of Minnesota friendly. However, we have them all boxed off for you to enter your state information. Each Department of Health has an infectious disease epidemiology prevention and control. Like you'll be able to look up that number and enter it without having to draft all of the sort of details of the policy and procedure. So This is the policy and procedure manual I used for my audit. And it covered, like, there was absolutely no questions about any of the policies and procedures listed. We're offering this. We normally charge about $800. For those of you who are participating in this event, we're marking it off 25%, and it's only $600 now. So if you want to access this, you can just email info@thrivebuildingservices.com before Sunday at midnight, and just send us the code summer savings. If you don't add the code and just say you attended, we will also give it to you for that price point. It's a 45-page document. Again, covers all of the policies that you need listed. I'm actually going to pull up the page. These are the only ones. This is the very first page of the document. Oops, it's not sharing. Hold on one second. Oh yeah, it is showing. Okay. So you'll see these are the only ones that are not, there's not a policy listed, because they'll either be included in your informed consent already. And I actually think I did add the pet one, like if there's like an animal policy. So that is included in the policy and procedure manual. But these specific policies that they ask for in it, that's built in to what I would think would be in the informed consent. And I was like, I don't think I need to write an informed consent for people. And then the assessments of staff competency, I feel like that varied enough for it to be included. That would be something that each individual practice would have on their own. Yeah. I think that is everything. In addition to the supervisory protocol, policy and procedure manual, we also offer contracting and credentialing, monthly billing packages, special projects. We provide a lot of that administrative support. And if you're interested in any of that, if you want a free quote, you can visit us. You can use this QR code. Otherwise, you can visit us at our website at thrivebuildingservices.com and get our information there. Yeah.
Ashlee, Sterling had a question about they had heard that the supervision protocol had been paused. Have you heard anything about that?
Yeah, so I heard that. So I reached out to the rep for my county, and they mentioned that commercial plans were paused, but to reach out to your advocate for like the most up-to-date information. And I also know that they are still allowing like Medicaid plans to go through. So she didn't really elaborate on any of that, but I would certainly reach out. Like if you found your advocate in on that list or through that list that I provided a link to, and if you came in after I sent those links, I can resend them again. That they would have the most up-to-date information. But I'm very curious to hear. I didn't hear about the reevaluate part. I just, insurance is always like pause or open up their plans. So we'll see. And if they do a reevaluation, we'll do an updated event to see what it includes. Does that answer your question? Excellent. Great. Any other questions? Thank you all for staying and being a part of this event. I really like talking with providers and helping them grow and expand their practice. It's it's like a fun business side of this world. All right. Well, great. Well, thank you, everyone. I can't believe we got through all of this in just under an hour. If either of you need anything, please let us know. Don't hesitate to reach out. We'd love to hear from you. Yes. Thank you. Thanks for coming.
Thanks. Bye.
Bye.